On Tuesday afternoon, the 17th of August 2021, we were advised of a case in the community with no obvious connection to the border. In a matter of hours after this, the Cabinet had met and agreed a move for all of New Zealand to Covid-19 Alert Level 4 from 11:59 p.m. that evening. It's now 14 days since Covid-19 re-emerged in the community and New Zealand moved to Alert Level 4. It was news that nobody wanted. The events of the last 2 weeks, however, have once again confirmed the value of going hard and going early. Elimination remains New Zealand's best strategy and we are throwing everything at it. On Monday, the 23rd of August, Cabinet agreed to extend Alert Level 4 for the rest of the country, and yesterday Cabinet also confirmed a decision from last week to move all of New Zealand south of Auckland down to Alert Level 3 from 11:59 p.m. this evening. Cabinet also agreed to keep Auckland at Alert Level 4 until at least 11:59 p.m. on Tuesday the 14th of September, with a review of those settings on Monday the 6th of September. Unfortunately, the latest outbreak has particularly affected Auckland. Once again, Auckland is doing the heavy lifting, and we acknowledge their immense efforts and the sacrifices they are making for us all. Based on the size of the current outbreak, based on the number of daily cases we're seeing, and based on the need to sustain reduction in cases before moving alert levels, Auckland will remain at Alert Level 4 for another 2 weeks. Northland will move down a level from Thursday if the remaining tests that we are waiting for come back negative. We need to be confident that we do not have Covid-19 Delta circulating undetected in the community, and we need to be confident that any cases we may have are contained and isolated. Signs are encouraging that after the hard work of all New Zealanders, we are seeing the effects of the lockdown starting to turn the tide. We're seeing a decrease in cases outside of households, a decreasing number of locations of interest, and the reproduction rate starting to reduce. That's not to say that we are out of the woods yet. We'll continue to see new cases reported from these Auckland clusters for a while yet. In the last 2 weeks, we've processed just over 420,000 tests. Our contact tracing has also performed strongly. Approximately 34,500 contacts have been identified, with 28,839, or around 80%, being contacted by a national contact tracing solution. Also, a shout out to our MIQ staff. There's no doubt the managed isolation and quarantine system is under pressure, and their incredible and ongoing efforts to help keep us all safe deserve acknowledgement. They are New Zealand's unsung heroes. Our schools too are once again stepping up to minimise the disruption to students and their families, and we thank them. We have gratitude for our vaccination workforce, GPs, pharmacies and Māori and Pacifica health providers. The rate of vaccinations has been increasing. In the last 2 weeks, we've had more than 7 record days, which are averaging approximately 430,000 doses administered per week. In total, 3.4 million doses have been administered, including 2.2 million first doses and nearly 1.2 million second doses. We do know, and I acknowledge that everybody in the House has shown public support for this, that the vaccine is our best defence against Covid-19. It is free of charge and it is safe to use. Vaccine shipments continue to arrive regularly. Throughout our response to Covid-19, we've used the latest evidence and the best advice available to us at the time. We've learned and we've adapted, and we will continue to be guided by the science. Last week, I announced the introduction of mandatory record keeping for busy places and large gatherings. These are the sorts of places where people gather consistently and in larger numbers, such as cafes, restaurants, bars, casinos, concerts, aged care facilities, healthcare facilities, barbers, nightclubs and libraries. It's now mandatory to wear a mask when visiting a business or a service at Alert Level 4. We've also, based on the latest scientific evidence, widened the gap between vaccine doses from 3 weeks to 6 weeks to get wider population coverage sooner. Of course, we'll continue to follow the science. For example, what it tells us about the most effective timing for booster shots and ongoing vaccinations. All government border workers in high-risk jobs are now required to be vaccinated, with checks and balances in place to ensure that this is happening. By the end of next month, all those working in jobs at the border that may see a person come into contact with Covid-19 will also need to have been vaccinated. These are measures to protect those doing those jobs and to ensure that we are plugging any further gaps in our border defence. We're doing all of this and more while continuing our work on the Reconnecting New Zealand strategy, which we announced a few short weeks ago, though it feels a lot longer. It's understandable that New Zealand is totally focused on the here and now and getting to the other side of this outbreak. As I said earlier, the government is throwing everything at it, but we are also looking ahead. We will not lose sight of the medium and long-term goals, and I can assure the House that planning for the future also continues apace. Can I end by acknowledging once again that the last 2 weeks have been difficult for a lot of people. No one wanted to see COVID-19 re-emerge in the community, but we always knew that it was possible and that it could happen. We know that the best way to protect our people and our economy is to stamp out this virus. And, thanks to the hard work of all New Zealanders, we're making great progress to do that again.
Chris Bishop.
Thank you, Mr Speaker, and can I thank the Minister for COVID-19 response for that update. Can I also start, sir, by thanking everyone who has gone out and got a test in the community, thousands of people. Thank our essential workers who are keeping our shelves stocked, keeping the country fed, keeping the country moving. Thank our healthcare workers who were under pressure before but are even under more pressure now. So everyone doing the testing, doing the vaccinating, including those in the conditions in Auckland today. And thank you to all the Kiwis who've lined up to get vaccinated. That's the way out of this lockdown, and it's the way out, or the way to connect to the rest of the world. Some questions for the Minister. How many contacts have been identified but have not yet had a test?
Mr Speaker, I can run through those, if I get the right table, I can run through those in a bit more detail. In terms of the closest contacts, if we call them that for now, 924 of them have been identified, and we have results for 738 of them. Of the close contacts, the next level down, 30,887 have been identified and 27,687 have been tested. We have a test result for so far. It's important to note that there will sometimes be a justifiable reason why a person may not have been tested yet, because that's determined by when their potential exposure was. And if they've only recently been potentially exposed, the test may not be taken immediately. It may be taken a couple of days later.
Can I ask the Minister why these updates are not regularly provided as part of the 1 p.m. or sometimes 4 p.m. Updates? They tend to be a little bit sporadic. Sometimes we get them, sometimes we do not. And I think there would be greater surety for the public if they were provided as a matter of course by the Ministry.
I think one of the challenges for the people who produce all of this information every day is that there is a very large volume of information that they're dealing with now. There's 612 total cases that they're dealing with at the moment, which is far greater than we've dealt with in previous outbreaks. It does mean that there is a bigger lag between when information is first identified and when it is publicly disclosed. So often the case information, the case numbers that we get and that we release each day will then be followed up by a more detailed breakdown of the case information from the day before, because of the amount of time that it takes just to make sure that we're compiling, or that the teams are compiling that information and reporting that as accurately as possible. We certainly do endeavour to be as transparent with the information and with the whole variety of different statistics as soon as we possibly can be.
Can the Minister tell the House how many COVID positive cases have been infectious in the community since the lockdown started?
I can't give an absolutely accurate account of that at this point. What I can say is if we look at our essential workers, for example, there are over 100 essential workers who have been identified as positive cases, I think from memory about 107. So far we've only seen evidence of 4 transmission events in the workplace. Those numbers do move around a bit, but those were the most recent numbers that I had to hand.
Yesterday or the day before, we were told that the effective R rate was less than 1, which is obviously good news. Is it still, a couple of questions on that, is it still less than 1 today? Is it being calculated daily? And if so, why is it not being made public daily?
Mr Speaker, I'm sure that the R rate could be included in the daily updates if that's what the member wanted. The advice that I've had is that the R rate continues to trend down.
Can I ask the Minister around contact tracing, which has been an area of concern for people? Why did it take 6 days for the public service to start secondments from within the public service to public health units to boost up surge capacity for contact tracers?
Mr. Speaker, one of the things about the contact tracing process when you're dealing with a large outbreak is that the overall numbers of contact tracers required continues to grow. We don't necessarily need as many contact tracers in the beginning when you're chasing down a smaller number of cases, but as that case number grows, it's important that we surge that workforce, and that's exactly what's been happening.
To the Minister in relation to that, and I think he's touched on an issue that people are concerned about, which is the lack of planning for this outbreak. And I'd refer him to the remarks of Philip Hill, who most recently conducted a report for the government in relation to contact tracing, saying, and I quote him, "We previously warned in each of the 3 previous reports since mid-2020 that New Zealand would struggle to deal with a significant outbreak if capacity wasn't increased substantially. We have not seen how this has been addressed since the report submitted in early June this year." A lot of people are very concerned that despite repeated warnings by a variety of experts since the lockdown last year, not enough effort has gone into increasing surge capacity for contact tracing. What is his response to that?
Mr. Speaker, I would say to judge the system based on its results in the current outbreak. So if we look at the overall number of close contacts that have been identified, recognising that we are differentiating between the closest contacts and other close contacts, we're talking about over nearly 32,000 identified so far. That's over a 14-day period, so that is well more than the 1,000 a day that some of those earlier reports were identifying we needed the capacity to be able to contact trace.
Does the government have an updated version of what's become known as the Aisha Viral Metrics, which is how people can essentially assess how the government's doing? Obviously, I think everyone recognises the April 2020 numbers are out of date now, or the metrics are out of date, but what are the new metrics?
We haven't necessarily agreed a final revised set of metrics. We continue to use those metrics as they were identified by Dr. Verrill. It's important in the way that they're reported that we differentiate, I guess, between the very early phase of an outbreak and the bit that we're in at the moment, where more regular updates are required that remove from the statistics some of those earlier numbers, because those earlier numbers can be distorting of the overall performance of the system here and now.
A couple of questions on alert levels. If contacts in the South Island continue to test negative, when will the South Island move down alert levels?
Mr. Speaker, the Cabinet will make further decisions on that next week. I generally am very reluctant to crystal ball gaze and forecast what might be in those decisions. But of course, if we continue to see no cases outside of the upper North Island, that's very encouraging, and that's certainly something that Cabinet will be looking very closely at. But we'll also be looking at the testing results for those contacts that have been identified who are currently isolating outside of the upper North Island. We want to make sure that they've all been tested and that we've got all of the results for that. I think the last thing anybody wants to see is that we go down alert levels and then find another positive case or two pops up and potentially increases the risk profile. We want to eliminate that possibility as much as we can before any alert level change.
How many people are still at home waiting to be transferred to an MIQ facility?
That number does vary. I think the latest number this morning was that it could be sitting around 50 to 60 people that are awaiting transportation. There's a couple of things in that. There are various parts of the process, and we've been working to make sure that we understand every part of that process, including the bit between referral and MIQ, getting the notification, and then MIQ getting someone to go and pick them up and transfer them to quarantine. There can be a lag in some parts of that process, and we've been working to identify where the potential delays in that process are so that they can be remedied as quickly as possible.
Does he have any numbers on just how long on average people wait between testing positive and having to be transferred to MIQ? I know it may not be possible to work it out on average, but even just a guesstimate for about how long it takes?
No, I don't, but I can certainly give the member a breakdown. The vast majority of people are there within sort of 48 hours, but I just don't have the statistical breakdown, but certainly happy to find that.
I understand Pacifica make up a large proportion of the people we're talking about here. A couple of questions in relation to that. Are there translators available on site if required? Has there been a requirement for the translation of documentation? And what welfare checks and services have been put in place for this community?
In answer to the question around overall translation, yes, translation is provided where necessary. In terms of the documentation, the welcome pack that people get when they come into MIQ has been translated into a number of languages. Samoan is one of those languages that it's already been translated into. We are looking at whether there are other Pacific languages, given that there are a number of Pacific people involved in this current outbreak, that it should be translated into as a matter of priority. But I can confirm that translation is available even in a variety of different languages, even if the hard packs of materials aren't translated into every conceivable language at this point.
We've been told by high sources that the government's obsessed with the source investigation into the Crowne Plaza. Can you provide an update to the House on how that's going? And is there a current working hypothesis on how the case got from the Crowne Plaza to case A?
Look, I can assure the member that there is a lot of emphasis going on finding out exactly what happened at the Crowne Plaza. As the Minister responsible for MIQ, of course, I want to get to the bottom of that because it's one of our larger MIQ facilities and I want to be able to put people into it again, and that will be a lot easier once we know exactly what has happened there, if in fact we can find out exactly what has happened there. There are a variety of different scenarios that are being explored, and I'm not willing at this point to put my penny down on one of them as being the most likely.
Was he surprised to learn that the Crowne Plaza passed all its infection control audits most recently as June?
Mr. Speaker, yes, I am. The one remaining issue, or the one additional risk that has been identified is that one of the physical barriers in the atrium didn't go all the way to the ceiling. That's been remedied. One of the things that they've been testing is to make sure that in imposing effectively an airlock by bringing a barrier all the way to the ceiling, that we're not increasing the potential flow of air from one space to another through the air conditioning system. So they're in the process of testing all of that at the moment. In terms of the alleyway down the side of the facility that people are concerned about, I would note that there is a solid barrier between the alleyway and the exercise area.
Why did it take an outbreak for the government to commence an investigation of infection control and MIQ in the light of the Delta variant when Delta has been in our MIQ facilities for some months now?
I completely reject the member's assertion in that question. Regular audits of infection and prevention control in every one of our MIQ facilities are being done all of the time, and they are always taking into account the latest science regarding all of the different variants and also what we understand about the existing viruses or the existing variants of the virus that we have been dealing with. Those audits are being done by IPC experts who are versed in the latest information and the latest research.
Well, the member might reject it, but I'm just merely quoting both him and Dr Bloomfield, and I think also the Prime Minister, who has said that the government will be doing a review of MIQ facilities in the light of the Delta variant. But notwithstanding that, can I ask about Bluetooth tracing? We've all been told for many months now, turn on your Bluetooth and use it, and now it turns out in this outbreak that Bluetooth is not being used as part of the contact tracing. I think many people are surprised at that. Why is that the case?
Mr. Speaker, the contact tracers will use the best information that is available to them. Bluetooth is one of the tools that we supply to them. They will make judgments about whether the data that they're getting out of Bluetooth or out of the QR code scanning or out of other methods is the best data to use in the context of a specific case investigation.
So can he say, hand on heart to New Zealanders in the House right now, turn on Bluetooth, in light of the fact that we have a very large outbreak with a high number of close contacts, and Bluetooth has not been used, as I understand it, since August 17 as part of the contact tracing?
Mr. Speaker, yes, I can. I can say to all New Zealanders that there are a whole variety of things we ask them to do as precautionary measures in the event that we need to obtain that information, including scanning QR codes if they're in the South Island, for example. One could say that because we haven't sent any or we're not sending out current push notifications to people on the South Island, they shouldn't scan their QR codes. They'd be wrong if they were making that assertion. Having Bluetooth turned on adds an additional tool to the toolkit, and it's relatively, it doesn't cost people anything. It doesn't mean that they have to do anything extra other than one thing that takes about 30 seconds to do.
Final question on saliva testing. Dr Bloomfield said a week ago the government was going to talk to private sector partners for potentially saliva testing. What has happened to that, and why has the government not used it as part of this outbreak?
Well, Mr Speaker, we are using saliva testing, and that includes for those who are on a regular testing cycle, so they can access saliva testing now, and hundreds of our border workers are taking up the opportunity to do that, and we continue to look at how we can continue to scale that up.
David Seymour.
Point of order, Mr Speaker.
A point of order, David Seymour.
Mr Speaker, I seek leave for the House to re-establish the Epidemic Response Committee on the same terms as it resolved on March 25 last year.
Is there any objection to that taking place? Yes, there is. A point of order, Chris Hipkins.
Mr Speaker, I seek leave for the House to adopt a sessional order to allow the remote sittings of Parliament based on the draft plan as presented to the Business Committee.
Is there any objection to that? Yeah, Mr Woodhouse.
Mr Speaker.
Oh, you'd like a call? David Seymour.
Thank you, Mr Speaker. I want to first of all thank the Minister for COVID-19 recovery for his comments, and also give on behalf of ACT our most heartfelt condolences for those people who are suffering the effects of lockdowns, those people in small business where people feel enormous stress about their future, those kids who are missing out on educational opportunities, those people who need healthcare and risk being displaced as hospital capacity is reserved for potential COVID cases. Mr Speaker, New Zealanders have played an extraordinary part following the rules, getting vaccinations when they are available, and to some extent using QR code scanning. But there remain a number of questions about the government's response, and in particular whether or not the government could have done far more in the past 18 months in order to prepare for the current Delta outbreak, and questions about what it will do next to ensure some greater certainty in future. I'd like to put a few questions to the Minister, particularly in relation to vaccination. The Minister said on 22nd of August that there were 750,000 doses in the country, having just received a total of 380,000 that weekend. A week later, the Prime Minister told us there were 840,000 doses, after an additional 320,000 were received. I'd like the Minister to explain how you can have 750,000, use twice as many as you received, and end up with 90,000 more than you started.
Mr Speaker, it's very easily answered. We don't hold all of the vaccines in the central store. There are two different numbers here. There's the number of vaccines in the country that have not been used and the numbers that are being held in the central store. At the moment, we have over 300,000 in our central store, but nearly 500,000 are out distributed around our vaccination centres and have yet to be used.
How then does the Minister reconcile his statement that there were 750,000 doses in the country when the Ministry of Health recorded only 459,000 in the central store on the same day?
Because not all the vaccine doses are stored in the central store. Some of them have already been distributed to vaccination sites.
So is the Minister now telling us that there are 500,000 distributed to vaccination sites at any time? And if so, can he tell us how many are in the country today?
Well, Mr Speaker, I don't think the member's been listening to the answers that I've been giving him. I just indicated to him that we've got just over 300,000 in our central store and just under 500,000 distributed around the country in our vaccination centres. Of course, our vaccination centres are doing a phenomenal rate of vaccinations at the moment, so I cannot give him an up-to-the-minute update of how many they are holding versus how many they have just administered.
Why won't the government simply publish both numbers if they know them and are able to announce them at press conferences?
Mr Speaker, as I've indicated to the member, and again, if he perhaps listens to the answers, he won't need to waste his questioning time because the answer to that is quite clear. We don't have up-to-the-minute information because we are not asking the vaccination centres to report the number of vaccinations they're doing every minute.
The strategic advice from Professor Sir David Skegg said that New Zealand will have more options for responding to COVID-19 when the vaccination program is complete. I asked Professor Skegg earlier last week what he meant by the vaccination program being complete. He said that he had not defined it, instead leaving it for the government to define. I wonder if the Minister could explain what it is that he thinks of when he talks about the vaccination program being complete, and how will New Zealanders know it's complete if there is no vaccination target?
Mr Speaker, the epidemiologists have been very clear that setting a numerical target, particularly a numerical target as low as some opposition members have been suggesting, is not necessarily the best way forward for New Zealand. Our goal is unambiguous, which is to ensure that every New Zealander who is eligible has the opportunity to get a vaccination by the end of the year, and as we can do so safely, expand eligibility to additional population groups, to younger New Zealanders. And the member in the House will have seen that the government recently made a decision around that to extend to the 12-plus age cohort who weren't previously eligible, and we've done that once we have been convinced that it is safe to do so.
On what date did the government first begin discussing with other countries borrowing Pfizer vaccine doses in case of New Zealand facing a shortfall? Was it earlier this year? Was it this month? Or was it within the last week?
Mr Speaker, our discussions with Pfizer and with other potential supply partners around vaccine access for New Zealand have been ongoing, and I don't believe it would be in the public interest for me to reveal all of the intricacies of those discussions.
We're not asking for any intricacies, just was it in the last week, the last month, or earlier this year that those discussions began?
Mr Speaker, discussions have been ongoing over the last year around vaccine supply.
And were those discussions in relation to borrowing additional Pfizer vaccine doses from other countries?
Mr Speaker, there have been discussions with other countries since the beginning of the vaccination program around vaccination supply. All countries have been grappling with this. Of course, our MFAT network, our political leaders and others have been in discussions around vaccine supply since before vaccines were even approved.
Has he, his officials, or anybody in the Ministry of Health at all offered, or MB for that matter, offered to pay additional money to Pfizer, as Canada has done, to get additional doses faster? Have they discussed with AstraZeneca getting additional vaccine doses in the last 2 months? Or is it the case, as the Prime Minister alluded this morning, that it is not possible to have vaccines from other suppliers because the supply chain just isn't set up to distribute them?
Mr Speaker, in answer to the question around AstraZeneca, the New Zealand Government remains committed to a Pfizer-based vaccination campaign at this point, and that is what we are absolutely focused on. In terms of the issue around Canada, what the member refers to is some discussions with, that the Canadians undertook with Pfizer late last year when the Pfizer vaccine was still in its very early stages of production, to increase production in order to facilitate access to a very limited number, and we're talking hundreds of thousands of doses, not millions of doses, in the early part of the emergency vaccine approval process, which is not something the New Zealand Government has done. I have had conversations directly with representatives of Pfizer to discuss this issue. Pfizer have been very clear. Their production, the production that they have of the vaccine, is fully committed around the globe, and they are not willing to offer rich countries the opportunity to pay more in order to displace countries who cannot afford to do that, which suggests that Big Pharma has a higher ethical and moral standard than the ACT Party does.
Of the 17 cases announced today that were not in households with existing cases, can the Minister tell us how many of them were infected after level 4 conditions commenced. And if he doesn't have access to today's numbers, would he be able to tell us how many of the cases that have been reported from outside existing infected households were infected outside that household since level 4 began?
Mr Speaker, no, I don't have that information in the form that the member asks for. Dealing with data around case investigations is always one of the big challenges when you're dealing with an outbreak of the size we're dealing with, where there's over 600 cases. The key things I think the public would want assurance of is that the people who need to know the various information about each one of those 600 plus cases do know that information and that they are providing information to us in as timely a manner as possible to support decision making. I don't have the particular breakdown of data that the member has asked for.
The time for the opposition is concluded. There is an opportunity for reply if the Minister wishes. The Honourable Penny Hanami.
Thank you, Mr Speaker. I rise to make a ministerial statement relating to the NZDF's involvement in the evacuation from Afghanistan. Tuatahi māku ka tangi atu ki ngā aitua maha ka pā ki roto ki tēnei tū āhuatanga. Haere atu rā koutou. First, I wish to acknowledge those who have passed throughout this terrible time. I want to acknowledge, sir, the more than 3,500 NZDF and other agency personnel and veterans, and in particular, the 10 New Zealanders who lost their lives during the 20-year deployment to improve regional security and development in Afghanistan. I would also like to acknowledge the opportunity today, Mr Speaker, to speak to recent events in Afghanistan. I welcome the interests of the public and members of Parliament in the significant and complex developments in Afghanistan over the previous weeks. These are important issues and ones that will continue to impact the global community for months and years to come. On 19 August, I and a group of ministerial colleagues whom Cabinet had appointed with powers to act for this operation approved the deployment of an NZDF C-130 Hercules aircraft and up to 80 NZDF personnel, some to operate on the ground at the Kabul airport and the remainder to be based out of an airbase in the United Arab Emirates. We had NZDF personnel on the ground at Kabul airport within 4 days of the ministerial decision to deploy our Defence Force to support the international efforts to evacuate and resettle civilians from Afghanistan. These personnel were able to get to work executing the instructions of MFAT and MB colleagues, making this a truly interagency effort. That is an exceptionally fast response, considering the complexity of the operating environment and the unfolding situation at the time. This demonstrates the high levels of training that the NZDF maintains to deliver its primary output of military operations to the government and people of Aotearoa, New Zealand. During the deployment, the NZDF C-130 Hercules and crew made 3 evacuation flights to and from Kabul airport, succeeding in evacuating a number of civilians from Afghanistan as part of the wider coalition effort. I also want to specifically commend the bravery, tenacity and resilience of our ground forces who operated from the heart of Afghanistan at the Kabul airport throughout the deployment. These personnel made an extremely valuable contribution. Of particular note are the outstanding efforts of our Special Forces personnel, including a female engagement team located at Kabul airport. This team made contact with approved evacuees and guided them through the crowds to points on the perimeter where they could be brought into the airport, secured and safely evacuated. The NZDF deployment concluded its operation out of Kabul airport on 26 August. The US had signalled that the military airlift would conclude by 31 August and that partners would need to depart days earlier than this, as the final days would be reserved for the US withdrawal of its significant numbers of personnel. The threat of terrorist attack was also a factor in the decision to conclude our activities out of Kabul airport when we did. As highlighted by the Prime Minister and the Chief of Defence Force in their media stand-up on the matter on Friday, 27 August. By that time, MFAT had advised people not to come to Kabul airport. Sadly, that threat materialised in the early hours of 27 August New Zealand time, with the heinous act of terror perpetrated by the Islamic State in Khorasan province that we witnessed outside the Kabul airport mere hours after the NZDF presence had withdrawn. I want to reiterate the Prime Minister's statements on Friday in relation to this. We condemn this despicable act on the innocent trying to flee to a better life and on those trying to escort them safely to their flight to freedom. New Zealand's thoughts and aroha are with the families of the civilians and US personnel who sadly lost their lives. It is important to recognise the close cooperation and partnership with our closest defence partners throughout this deployment, including the US, Australia, the UK and Canada. It is clear that without the US leadership and forces on the ground at the Kabul airport, the evacuation would not have been able to occur. The contributions of the UK and Canada were also central, but I must especially recognise the true comradeship and partnership between our NZDF deployment and the Australian Defence Force deployment. We have jointly provided airlift for each other's evacuees, supported each other on the ground in Afghanistan and in the UAE, and we have benefited hugely from this cooperation. This deployment has shown that the Anzac spirit is alive and well. I would also like, sir, to take this opportunity to acknowledge the stalwart support and hospitality of the UAE government in permitting the NZDF to operate from the UAE for this deployment. I spoke with my UAE counterpart last week and can confirm the close and meaningful defence relationship we have with the UAE. The military-led evacuation effort from Afghanistan has now concluded. We were not the masters of this time frame, and we did all that we could to evacuate people within the time that we had. We knew this was a risk given the short time frame of the international evacuation, and the Prime Minister mentioned this last week. And I know this is a weight that rests heavy on all the agencies who form part of the truly interagency New Zealand contribution to the Afghanistan international military evacuation. We are not turning our backs on those still in Afghanistan. We will continue to see how we can support those seeking to leave Afghanistan. However, that will no longer be a militarily led effort which the NZDF will feature so prominently in. It will also be within a much larger international effort that New Zealand will be a part of. Finally, sir, I'd like to conclude by again acknowledging the bravery and service of our Defence Force personnel who have conducted this deployment under incredibly difficult circumstances. I know that I speak for all New Zealanders when I state how proud I am of what they have achieved and how they have demonstrated the force for good that Aotearoa New Zealand is on the world stage.
Order. Before I call the Leader of the Opposition, I didn't want to interrupt the Minister who went about a minute over his time. I will give both opposition leaders the opportunity to have a little longer as well. The Honourable Judith Collins.
Thank you, Mr. Speaker. I rise on behalf of the New Zealand National Party to express our heartfelt sorrow for the tragic loss of life due to the terror attack at Kabul airport. Our condolences go out to the families and friends that these victims leave behind and to all those who have suffered needlessly from terrorist attacks in Afghanistan and elsewhere. There is nothing that we can say today that will bring the comfort that they need, but what we can do is we can continue to speak up and condemn such senseless, cowardly violence whenever and wherever it occurs. New Zealand will always continue to speak up for basic humanity, for human rights and democracy, for the right to religious freedom and freedom of expression, for women's rights and the rights of children. I can now add to that the rights of artists, the rights of those who say the things that regimes don't want to hear, for the right to live free from violence and fear. And so to those who perpetrated this attack on these freedoms, we condemn you absolutely. We will have no truck with you. Equally to the brave men and women in our Defence Force who have served in Afghanistan and elsewhere, we express our sincerest gratitude. I can add to that the brave men and women of New Zealand Police who worked so tirelessly to help build and train the Afghan National Police. Your hard work and professionalism under such harsh conditions is something that all New Zealand should be proud of. The difficult situation facing the Afghan people today does not mean that the amazing work that you have done over the last 20 years was for nothing, as some have suggested. Your work saved lives, you built infrastructure, you built schools, you built water systems, you enabled young girls to go to school. That counts. One of the great privileges that I have had in my time in politics to date has been able to be with you in Afghanistan, visiting with New Zealand Police and also with our Defence Force. I've seen some of the work and the successes that you've had in places like the Bamiyan province, and I've seen you working in Kabul. There was one time travelling in Afghanistan, Kabul, where our SAS personal protection officer said to me, "Look out the window, Minister." I looked out the window and I saw hordes of people, complete chaos, people seeming to just somehow make their way through life. And he said, "No, look at those young girls. They're in school uniforms. They're going to school. That's why our job counts." And by goodness, that was why their job counted. They made an opportunity that would not have been there otherwise. But the fact that we were forced to leave behind many of our Afghan allies, people who risked their lives to support our defence and police personnel, is extremely concerning. It is a humanitarian crisis of historic proportions happening in Afghanistan. And it's concerning that the government seems to have been caught so unprepared. It is a stain on our work in Afghanistan. The political situation in Afghanistan has moved quickly, but it should have been no surprise that something like this would happen. The Prime Minister here indicated in February this year that New Zealand would withdraw our forces from Afghanistan. The people left behind may well be the drivers, the labourers, the interpreters, the cleaners and the cooks, innocent people to whom we owe a debt. So some wrote directly to the Prime Minister in May this year, and it's been reported that the Immigration Minister rejected many of their applications to come to New Zealand as recently as July. The lives of these people are now at risk, but the government hasn't explained why those pleas were rejected. So other countries have been evacuating these people for months, and it seems we've waited too late. So some questions that deserve an answer from the Minister. Why was the evacuation not completed weeks ago, given the withdrawal of troops was signalled early this year?
Mr. Speaker, thank you for the question. The fall of the Afghanistan government has occurred far quicker than any of the intelligence predicted. Even in early August, a week before the Taliban seized Kabul, US officials were still assessing that a swift Taliban takeover would still take approximately 90 days. New Zealand, along with the international community and partners, worked with the best intelligence we had at the time. Decisions were made. We have responded to this unfolding humanitarian crisis as quickly as we could.
How many Afghan people who supported our defence force were unable to be evacuated?
Thank the member for the question. The numbers that were evacuated from the airport in Kabul are currently still being processed. We'll have a clearer indication of those final numbers in the coming days, I'm sure. With respect to those who we know worked with the Defence Force, we have continued to stay in touch with them. We know that for some, even getting to the airport was particularly difficult and weren't even in the vicinity of the airport. In fact, some had already reported to us that they were still in the Bamiyan province. The Prime Minister made it clear that our commitment is still to those people, and we'll continue to do what we can as a country to support the efforts to evacuate more people out of Afghanistan alongside our multinational partners.
With our Defence Force effectively exiting in May this year, why was a decision not made to bring out those interpreters and others who'd worked with our Defence Force?
Thank you, Mr. Speaker. Look, the first attempt to take out some of these people were back in the time of that member's government, and at that point in time the eligibility criteria was smaller than the eligibility criteria that this government chose to operate by, which saw the list actually grow. And in fact, some people are talking about just simply interpreters, but because of the definition that we used for the eligibility criteria, we see the inclusion of interpreters, engineers, mechanics and others onto this list. We will continue, as I've said, Mr. Speaker, to work with our multinational partners to ensure that we exhaust avenues to evacuate not just the people that we're talking with respect to those who worked with or alongside the New Zealand Defence Force, but of course others who have the ability and visas, etc., to come to Aotearoa, New Zealand.
Does the Minister accept that under the previous national government, when efforts were taken to then bring to New Zealand interpreters, we were leaving in Afghanistan troops?
Sorry, Mr. Speaker, I'm trying to work through that question, actually. What I'm quite clear on with respect to those who worked alongside the New Zealand Defence Force and the numbers that we were looking towards this deployment, I want to talk to this deployment because it's the one that I made my statement on. Our deployment to evacuate as many people as we can, I stick to the list that we, as the New Zealand Defence Force, had with the extended eligibility criteria that we decided upon as Cabinet. But I want to say too that, you know, as we look towards how we might do ongoing support with respect to evacuating not just that list but others who try to flee Afghanistan and come to New Zealand, we're committed to continuing to support action there, and we'll do that alongside our multinational partners.
So why did the Immigration Minister reject an application for resettlement in July, as has been reported in the media?
Mr. Speaker, I asked that member to direct her question to the Minister of Immigration. I will say, however, that from the time that our government considered the evacuation process, the numbers and the people who were coming through, the numbers that were coming to be a part of the list was a fluid number, and it continued to rise. But otherwise, to the specific case that she talks to, I asked the member to refer her to question to the Immigration Minister.
Did he ever ask his colleague, the Immigration Minister, why he rejected an application for resettlement in July, as reported in the media?
Mr. Speaker, I continue to have ongoing discussions with my colleague, the Minister of Immigration, but I can't speak to that particular case. But him and I have several and quite a number of conversations actually on the matter of the interpreters and others who were identified in the New Zealand Defence Force list.
Has the government made any attempt to communicate with the Afghans that we've left behind, and have those communications been successful?
The answer is yes, Mr. Speaker, and we will continue to do that in our attempt and our effort to support them evacuate from Afghanistan.
Will the government allocate any of our refugee quota specifically for the Afghan people who we have left behind?
Mr. Speaker, that decision is probably left for not me as the Minister for New Zealand, for the New Zealand Defence Force, but I will say as part of our efforts with respect to our multinational response to continual evacuation from Afghanistan and the resettlement of refugees, we will continue to work with our multinational partners, including the UN.
Have any New Zealand citizens been left behind?
As I indicated earlier in one of my answers, Mr. Speaker, a number of the evacuees are still being processed, and the numbers will be clear on who exactly was evacuated. From there, we'll have a better sense of who was left behind.
I'm going to apologise. I forgot to ring the 1 minute warning, so I will give the Leader of the Opposition a final question.
Thank you, Mr. Speaker. So, to the Minister, are you saying that you don't know if any New Zealand citizens have been left behind? If you don't know, can you tell us? Otherwise, can you just tell us how many have been left behind?
Mr. Speaker, I'll reiterate my answer that the numbers that were evacuated from Afghanistan are still being processed by our officials in the Ministry of Foreign Affairs and Immigration New Zealand. Once those numbers have been settled, I'm sure we'll have another discussion then.
David Seymour.
Thank you, Mr. Speaker. I join with ACT in offering very sad condolences to those who have already been slain by this awful regime. For those living in Afghanistan who now face an uncertain and brutal future under that regime, one devoid of many of the human rights, particularly for women and girls in Afghanistan, that had been hard fought and hard won at great sacrifice, not only by the Afghanis, but also by the New Zealand Defence Force and our allies over nearly 20 years. Mr. Speaker, it also is an event that has wider implications. One of them about the fragility of liberal democracy. The way that we live is a magnificent way to live, with universal human rights and respect for the dignity of the individual, regardless of their beliefs or identity of choices. But what has been shown in Afghanistan is how, even with 20 years of enforcement, it can vanish in only a matter of months. That is something for those of us around the world who cherish liberal democracy and universal human rights to reflect on, probably for a long time before we can make much sense of it. It also raises questions around the New Zealand government's response. We have a number of interests in Afghanistan. One of them is an indeterminate, you just heard, Mr. Speaker, number of New Zealand citizens who may be there. The other is many Afghanis who risked tremendous amounts, in fact they risked their lives, to help the New Zealand Defence Force and their fate, and what it means for the representation of New Zealand and our Defence Force doing business overseas in the future. Who would trust New Zealand given what has just played out? Mr. Speaker, the government was aware of the plight. It knew that these people were endangered, and now it's saying, well, it happened faster than we thought. That is certainly true, faster than anyone thought. The question that should be put to the Minister, and I will put it to him soon, is when did the government plan to end airlifting people out, and what date did it believe that was before? Mr. Speaker, there are also serious questions around immigration, and these have been summed up today by Justice Cook, where he says, I also accept they have an arguable case. This was in Afghan Nations versus Ministry of Immigration and the Chief Executive of MB. I also accept they have an arguable case. As I understand the allegations, the applications were no longer processed because the introduction of the Covid-19 border controls meant the applicants would not be able to enter New Zealand if their applications were granted. But when the evacuation attempts commenced, only those who'd actually been granted visas qualified for evacuation. I accept there's an argument that this outcome is not rational. The visa applications were not processed because the applicants could not enter New Zealand, and yet they were not eligible to be evacuated because they did not hold a visa. That's a catch-22 that may not be consistent with the lawful exercise of the statutory powers. Well, it's a tremendous amount of understatement by the judge there. Mr. Speaker, I think the government needs to answer a few questions. When did it plan to evacuate New Zealand citizens and those who helped our Defence Force? What is the pathway forward? Will there be special exemptions so that those who do manage to escape Afghanistan can live lawfully in New Zealand? Will there be a refugee exemption for those who helps the New Zealand Defence Force and to help restore our international reputation with them and others we may encounter in the future? And does the Minister take any responsibility for any failings of the government in this regard, or is it the fault of other ministers such as immigration?
Thank you, Mr. Speaker. There are a number of questions there, and I'll attempt to go through some of them while also outright refuting some of the assertions made in that member's contribution. The trust and the reputation and integrity of the New Zealand Defence Force internationally is strong and continues to be, despite the assertions made by that particular member. I can say, sir, that the NZDF did not employ anyone after April 2013 when the Bamiyan Provincial Reconstruction Team closed. Afghan interpreters played a critical role, yes, we agree, in the operation of New Zealand's Provincial Reconstruction Team in Afghanistan. In 2012 and 2013, the New Zealand Government provided a group of Afghan interpreters who had worked for the New Zealand Defence Force and Ministry of Foreign Affairs and Trade in Bamiyan Province with an assistance package which included the opportunity to resettle here in New Zealand. Resettlement was offered to interpreters as they were considered to be at the highest risk of Taliban retribution and reflected the service this group provided to the New Zealand Government during that time. The opportunity to resettle to New Zealand was also extended to the interpreter's spouse and dependent children. Financial support was also provided to local staff who were closely involved with the New Zealand Defence Force and New Zealand Police in Bamiyan, but who did not venture around the province with the NZDF and were therefore deemed to be less directly associated with the NZDF. New Zealand agencies and those of our partners had seen an increase in inquiries from locally employed contractors seeking resettlement outside of Afghanistan in recent months. Might I also note, sir, that there were also offers of financial support to allow some of those who were involved either directly or indirectly with the New Zealand Defence Force resettlement packages within Afghanistan, which I understand a number of them took. Another part of the question made by the member, sir, was around the decision to start evacuating people. Commercial flights still operated right up until the time when the US troops decided to close down the airport to use only for the evacuation efforts of a multinational evacuation operation. So any assertion from that member that we sort of turned the switch on only to make evacuations at that point in time are completely untrue. Evacuations and commercial flights continued up until the time the US troops secured the airport. I also want to say, sir, that one doesn't have to be in New Zealand to process an application. They can actually make representations to process an application for a number of visa classifications to be able to come to New Zealand here. And I know that this government and the officials in particular, Immigration New Zealand and the Ministry of Foreign Affairs, continue to work with these people and continue to do so today. They did so before we started the evacuation operation. They did so during the evacuation operation, which is why some of the intel informed our people to explain to the people who are trying to get to the airport not to come because of the threats associated with it. And I will reiterate the point, we continue to communicate with these people to see how we can assist even more evacuations out of Afghanistan.
Mr. Speaker, I make one brief comment. The Minister has attempted to interpret my comments as denigrating the reputation of the New Zealand Defence Force. I think it's fair to say that that reputation is legendary. Kiwi soldiers in a range of theatres have been recognised as more trusted and humane than from other countries on many occasions. It's not my intention to in any way denigrate them. My point was that the abandonment and the plight of those who helped the New Zealand Defence Force in this case won't have helped that reputation. And I asked the Minister, does he believe that the reputation of the Defence Force has been damaged by that abandonment? And if so, what is his plan to fix it?
No.